Hello, good morning, everybody.
Good morning, ma'am.
Morning, ma'am.
Am I audible?
Good morning, ma'am.
Yes, ma'am, audible.
Okay, so last class we have discussed from the um, which chapter we have discussed and which part anybody can tell. So which paper today is here? Anybody can tell? Am I audible?
Yes, you're audible, ma'am.
Yes. So tell me what I am asking. So BNS 032 paper and block 6 unit 1 we have covered, isn't it? Yes or no? Yes.
Yes, ma'am.
Yes, ma'am.
So the next unit, that is unit 2, it contains polytrauma, multi-organ failure, organ transplantation, trials and coding. Are you able to get it?
Yes, ma'am.
Yes.
Ma'am, polytrauma and what you say?
Organ transplant means kidney transplantation. Ma'am have covered, I think.
Yes, it's
Yes.
covered already.
Yes. So today we will discuss polytrauma, multi-organ dysfunction by multi-organ failure, and trias coding, and another thing from the unit 3 shock. Okay. So are you able to see the PPT?
Yeah.
Yes.
Yes, ma'am. But I think the slide is not open yet.
Okay. Okay. Now able to see?
No, ma'am. We can see the screen.
So what is it? Multi-organ dysfunction syndrome. Okay. So able to see?
No, ma'am.
No, ma'am, not yet.
What it is saying that screen is
That's fully black.
Black?
Like we can, yeah, we can't really able to see the slide. What is exactly presenting on screen?
Okay, okay. Wait little bit. It will be visible or not?
No,
No,
ma'am.
ma'am.
Visible.
Actually, in our skill lab, it is easy for sharing the, but in mobile and the computer without Wi-Fi, it will be difficult. So I can share from mobile also. I am trying.
Ma'am, voice is not at all audible, and screen is also not visible.
Okay, okay. Now it is visible. Is it visible now?
Yeah, we can see the screen, ma'am, at the moment.
Slide is visible or not?
Not the
Slide is
Your
not
slide.
visible,
desktop.
We
ma'am.
can see the
Slide is not
screen.
visible.
Okay, okay. Problem is
We
there.
can see that you shared commonly. The your screen is shared.
Okay, okay, okay. One thing I am trying. Otherwise, I will send someone and you will share.
Yeah, otherwise, yeah, it's easy. Maybe you can share on WhatsApp group and we can open
Okay.
it there. Yeah, now it's okay. Now it.
Now in mobile, I am presenting these things. Oh, yeah. So in the form of there is a format in the form of a PPT. You can see these things.
I think they have a play button, ma'am. Maybe that's
Now
for
PPT,
make the
that's the
screen
form
bigger.
in the form of PPT. We can say that mode. But in laptop, why it's not happening?
Export as a PDF. Oh, that's also fine.
Or I can send somebody. You can send. That's the problem. I actually don't find. So I'm again
As
one
far
time.
do you want to like?
I can share it. Once more, I am trying in the laptop. If it is not, then you can do it. presentation skin is possible. Sharing skin, stop sharing, then once more. Now is it visible?
Yes, ma'am.
Now it's visible, ma'am.
In laptop is it visible? Sorry, another mode I can put here. One minute.
So we can see that sepsis. Okay.
Is it visible?
Yes, it's visible.
Yeah, yeah, ma'am. Ma'am,
Yes, ma'am.
you can start the presenting mode. Then it will
My
be, I think,
presenting mode.
make the
I have
screen
shared
bigger.
present now. It is already there. That's probably my laptop. Actually, previously I was regularly presenting in the class. Okay.
Okay, it's all right then. Yeah, at least we can adjust with this one. No, yeah.
Okay. 1 minute. 1 minute. I will. Presenting about skin is not visible. Put a minute.
Ma'am, if there is any trouble in presenting PPT, then please continue your lecture and please share the PPT in the group.
Yes, no. I'm trying. Is it visible now?
Yes,
Yes,
ma'am.
it's visible.
Are you able to see the PPT?
Yes, ma'am.
Yes, ma'am.
Okay.
Ma'am, we cannot hear, ma'am. Ma'am, you are not audible, ma'am.
Ma'am, please share this PPT in WhatsApp group also.
Ma'am, your mic is off.
Okay. So now I'm audible?
Yes, ma'am.
Yes, ma'am.
Yes, yes.
Okay. So we have to discuss first in paper 2, that is your 032, and block 6, unit 2, that is your SARS and multi-organ dysfunction. So what is SARS? Anybody can say? SARS the full form? SIRS, SARS.
Systemic inflammatory response syndrome.
Yes. So there is a difference between SARS and multi-organ failure. Anybody can differentiate? Are you
Sorry, ma'am.
able to differentiate?
The question is not clear. Yeah.
We'll discuss, then again we'll ask the question. So SARS, what is SARS? SARS is an inflammatory clinical response, or the systemic inflammatory response syndrome. And what is that? It's a clinical syndrome or clinical response of the whole body without a proven source of infection. Are you clear? It's an inflammatory clinical response of the whole body without a proven source of infection. There is no confirmation what is the cause or who is the possible organism, what is the causative agent who is responsible for the infection. That is called as SARS. It is an inflammatory clinical response of the whole body without the proven source of infection. And SARS is non-specific, can be caused by ischemia, inflammation, trauma, infection, or combination of several insults. Okay, so are you able to get what is SARS? Clear or
Yes,
any
ma'am.
doubts?
Yes, ma'am.
Simply we can say SARS is systemic inflammatory response syndrome, and it is a inflammatory conditions where the whole body without a source of infection, the whole body is affected, and the cause maybe it is due to ischemia, due to inflammation, due to any trauma, due to infection, or combination of more than one or two things. Okay, so what is sepsis? What is the actual the question is, what is the difference between SARS and sepsis? Any idea you people are having?
I think SARS will be the primary response, like for example, against any pathogen in a body. So I think
Yes.
sepsis will be the part of the outcome. Like
Yes.
I know sepsis
No,
will be not
not
a.
exactly. Not exactly. So you can again think and tell me, or any other one can want to see give the answer. Please tell me. So there is a little difference. SARS is a wide things. You are partially right. It is a wide things, and sepsis is narrowed in the sense that in SARS
Is
the
it is it,
positive
ma'am?
agents, there is not. Yes.
No, no, I'm asking whether it's ma'am trying to explain whether it's
So this thing says that SARS with a confirmed source of infection through the blood or tissue is known as sepsis. In whenever the agent or the cause of infection or inflammation is not accurate or we are not confirmed, it is called as SARS. But when after culture or investigations, when the agent or the infective agents can be understood properly or confirmed, that is called as sepsis. Okay, clear?
Yes,
Clear
ma'am.
or not?
yes, ma'am, yes,
Everybody
ma'am.
clear?
Yeah.
Or
Yes,
any
ma'am.
doubt?
Yes, ma'am.
Okay. So SARS when confirmed with the source of infection or confirmed with the particular agent, that is sepsis. So which one is the SARS one is the blood mix. Please make your mic mute. So SARS, the definition of SARS in also we can say SARS is defined two or more of the following.
Please mute friend. Please mute friend.
Your mic.
Disturbance.
So you have to mute your mic. So SARS, whenever we are going to the definition, so there is a criteria. Whenever I am discussing those criteria, out of two or more criteria will fulfilled, then it is under SARS. So temperature, one of the point is temperature more than 38 degrees Celsius or less than 30 degrees Celsius. Heart rate more than 90 beats per minute. The rate of respiration is more than 20 beats per minute, or the partial pressure of carbon dioxide is less than 32 mm of Hg. The abnormal white blood counts, that is maybe 12,000 more than 12,000 or less than 4,000. That is leukocytosis or leukopenia. Okay. So out of these criteria, if the person has two or more than two criteria out of these, then he is suffering with SARS. Able to clear?
Yes, ma'am.
Yes. So what is
Yes, ma'am.
leukocytosis? What is the difference between leukocytosis and leukocytopenia?
It's a excess and less amount than the normal
Yes.
range. Excess amount of
Very
WBC.
good. The normal count of WBC, what is that?
4,000
4,000
to
to
11,000.
It's 5,000 to 10,000.
4,000 to 11,000.
4,000 to 11,000.
11,000.
Okay. So what is the partial pressure of carbon dioxide? What is the normal value?
Oh, we usually refer with normal range in the ABG.
35 to 45.
35 to 45 mm of Hg. So whenever it is less than 35, that is 32, less than 32, then it is under the category of SARS. So out of these criteria 1, 2, 3, 4, if anyone meets two or more criteria, then we can say that person is suffering with SARS. Okay. So now coming to what is the definition of multi-organ dysfunction syndrome, or what is MODS or what is MOPS. So MODS, any idea if people are having or anyone can say?
So I think it's an extreme, for example, multiple organ dysfunction. It's not a. Is it, ma'am, dysfunction and failure is same?
Okay.
It will be the complete failure of the all of the organ, the vital organ,
Okay. So
including
multiple from the name, that is your multiple organ dysfunction syndromes or MODS. So multiple organ. There are many organs in your body, you know. So dysfunction deviation from the normal function, and syndrome includes. What is the meaning of syndrome?
group of disease.
Syndrome means
Group of disease.
not a group of disease.
Group
Actually.
of symptoms.
Yes,
Symptoms. All right.
a group
Okay.
of signs and symptoms that is called as syndrome. So multi-organ dysfunction, there are more than one or two organs function is impaired, and many symptoms we get, that is called as MODS. So what is that? The presence of altered organ function in a client who is actually ill, such as homeostasis cannot be maintained without the intervention, and MODS is present when two or more organs fails. MODS results from SARS. So there is a relation between SARS and MODS. Can you correlate it?
It will be the multi-organ dysfunction syndrome will be as a complication. It will be
So
the end of
simply
the
we can
SARS.
say SARS is one of the cause, or the sepsis. Whenever SARS or sepsis is the cause of multi-organ dysfunction syndromes. So what is there? What happens in MODS? The presence of altered organ functions in a client who is ill, and such as homeostasis cannot be maintained without intervention. What is the meaning? There is a more than two organ not function properly, and that's why there is impairment in the homeostasis. So what is homeostasis?
Homeostasis is a body balance.
Yes, very good.
Equilibrium. Yeah.
Maintaining different physiological or balance. It's a state of balance in the body where different physiological mechanisms will be occurred. So the organs are impaired, so that there will be disturbance in the homeostasis, and without the intervention, the homeostasis cannot be maintained. The person can maintain the normal life, and if treatment is not provided in the actual time, then the person may go to death. This is the definition. So this is the organs, multi-organ, different organs which can be associated with this MODS: liver, bowel, CNS, heart, kidney, lungs, and also the systems. So classification of these multi-organ dysfunction syndromes. So what is that? There are two types of MODS. One is primary, another is secondary. So what is primary? Can you say?
Maybe one organ will fail first initially, and it will progress into multi-organ failure. Is it?
Say loudly, I'm not
Not sure.
able to hear you.
Maybe primary one will be maybe the single organ failure, and it will progress into multi-organ
Okay.
failure.
So two types, thank you. Two types of MODS are there. One is primary and another is secondary. Always primary is the direct source. So in primary MODS, the direct insult initially causes a localized inflammation response that may or may not progress to SARS. Okay. Example, primary pulmonary injury such as aspiration. Only a small percentage of clients develop primary MODS. Due to direct localized
Physical trauma.
yes, physical trauma, direct injury, that is causes the primary MODS. And secondary MODS, it is a consequence of widespread systemic inflammation. Here, In primary, mostly localized. The cause is localized inflammation or injury, but in secondary, it is the consequence of widespread systemic inflammation which develops after a variety of insults and the results in dysfunction of organ not involved in the initial insult. The client enters a hypermetabolic state that lasts for 12 to 21 days. During this time, the body catabolizes muscle and fat for energy, which causes profound changes in the body metabolic process. Unless the process can be stopped, the outcome for the client is death, and secondary modes occur with the conditions such as ARDS and the septic shock. So, what is ARDS?
Acute respiratory distress syndrome.
Yes. So the difference is
Acute
that
respiratory
there is
distress syndrome.
localized inflammation, primary cause or a direct cause, and here there is systemic inflammation and indirect cause, which develops after a variety of entry of organisms. And actually, what happens? There is a hypermetabolism, and the state can last more than 40 in between the 41 to 21 days, and different metabolic activities are there, hypermetabolizes, and due to that, the person also the may properly, if we are not treating immediately or proper time, then that can happen. So, what are the risk factors of this multi-organ dysfunction? Why there is multi-organ dysfunctions will be there? Any idea? If people can share.
Definitely. Yeah, age will be one of the factor.
Very good. Age,
And
advanced age.
like comorbidities, if someone is really
Chronic,
having any congestive, any,
chronic drug
yeah,
abuse may
diabetes,
be a risk
hypertension,
factor.
any heart failure, something like that.
Chronic drug abuse.
Comorbidities. Already
Okay.
someone is diagnosed with a CKD, something like that.
Good, good, very good. So commonly,
Untreated
can
sepsis.
share
Ma'am, prolonged
what is the
illness.
okay.
Ma'am, you are muted.
Ma'am,
Am I
kindly
audible?
share the PDF.
Is not sure, ma'am. Ma'am is explaining anything there.
Ma'am, you are still muted.
Now I am audible.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Echo is there.
No, it's okay.
Ma'am, you are not audible.
Now I'm audible.
I think
Ma'am, I think you have a network issue.
maybe it's. I think ma'am was presenting with a laptop. The laptop audio was we can be muted.
Yes, yes, I think.
So now is it clear? Now the voice is properly audible?
Yeah,
Yes, ma'am.
voice is clear now. Yeah,
Yes.
yeah,
Now it is okay?
yeah. But the slide is not clear.
Is it clear
Yes, ma'am.
now? Okay. So the risk factors are elderly patients or as you say advanced age. Then shock, another cause is shock episodes associated with ruptured
And your voice.
hypovolemic shocks. So there is a cause or risk factors. Then other factors chronic illness and malnutrition. How it is related? Chronic illness. If a person is chronic ill, for example, suffering with
Diabetes,
yes diabetes, then
hypertension, CKD.
so there are variety of common diseases and that also leads to the CKD. If there, for example, CKD is there, the person is having nausea, vomiting, and also she's not taking the nutrition properly, malnutrition, and malnutrition leads to your infections. Then this leads to your multi-organ failure. Then another risk factor, severe trauma, multiple injury, massive blood loss, hypovolemic shock, infection, severe trauma, like cross injury, polytrauma. So there is the source of infection is the infection will be easily travel to that part. So these are the risk factors. Other risk factors are prolonged inflammatory responses. Other risks clients with the
Septic
sepsis,
shock.
surgery, and massive blood transfusion. Then the etiology, yeah? After each factor, we have to discuss etiology or combined you can write the etiology. So the infection directly or indirectly may be injury or due to accident or blunt injury or rapid deceleration injury, may be hypermetabolism or hypoperfusion. Hypoperfusion means if there is
Less blood circulation.
decreased blood circulation and sepsis also. These are the due to sepsis. I will discuss how the pathophysiology will occur in the etiology due to etiological factors sepsis, how it will damage your organs and how the multi-organ system dysfunction will be there. We will discuss in pathophysiology all these things. Okay. So what are the etiology of MODS? That is etiology and a risk factor. Everybody clear?
Yes, ma'am.
Yes. So next we will proceed to the pathophysiology. So pathophysiology actually is not one. It's not a constant one. It will vary according to etiology, as you know. So
Oh, it's an emergency. Sorry.
So in commonly, what happens in the pathophysiology, that is due to any etiological factors, there is injury, either directed trauma or due to any infection or lack of perfusion. So this whatever may be the source of infection, this leads to a disturbed inflammatory response. As you know, due to that things, your inflammatory response will be disturbed. That's why the bacteria will enter to the wound and can release the toxins. Different endotoxins will be released by the bacteria, activation of systemic mediators. As you know, the process of inflammation, there is the systemic mediators is there, and due to these chemical mediators and the endotoxins, there is damage of the endothelial cells. So this leads to when this inflammation response is unchecked or not managed by medically, it will damage the organs, that is your respiratory too, cardiovascular, nervous system, renal system. Every organ will be damaged by these physiological changes, and there is altered perfusion after the oxygen supply, alternation in the metabolic functions, and also alternation in the coagulopathy. We will also discuss one by one. So this leads to a sepsis and multi-organ dysfunction. Are you able to clear the pathophysiology commonly?
Yes.
Yes or no?
Yes, ma'am. Yes, ma'am.
Anyone can explain me by seeing the slide also?
Yeah, sure. So there have a mainly several etiology like a polytrauma infection, and that will all leads to activation of inflammatory response of body. And as a part of inflammatory response, it will release a lot of toxins, especially like endotoxins, and that will leads further damage of endothelial cells and organs.
Very good. Cells, and this is not, if not checked in the proper time, then can leads to damage of the vital organs, leads to multi-organ dysfunction. So here you can see how the MOD can occur. First one, how the bacteria will enter. Second point, that is due to chemical mediators, due to the inflammatory response, there is vasodilation, and also there is leaking of the base cells from the which can pump blood outside the vessels and can decrease blood flow to the organs, decrease the blood volume. This leads to hypoxia. And whenever the altered tissue perfusion to different organs, that will lead to organ failure or organ dysfunctions. Okay. So, for example, in respiratory, another pathophysiology we can cover, particularly if there is inflammation due to the respiratory problems. The inflammatory mediator have a direct effect on the pulmonary vasculature, endothelial cell damage from the. I will share the slide. You can follow also. So many things we have to cover. Endothelial damage from the release of inflammatory mediator, increased capillary permeability, movement of the proteinaceous fluid from the pulmonary vasculature into the pulmonary interstitial space. Then, when interstitial space is filled with the fluids, then alveolar collapse, and this leads to a worsening the ventilation perfusion max, and that can lead to ARDS. Clear? Yes?
Yes, ma'am.
Understood? Or I will once more I will discuss, or I will share the slide. If it is not understood, you can say me. Okay?
Yes, ma'am. That will be very helpful.
Because many things we have to cover, and cardiovascular also like that. Simple, it can understood due to hypoperfusion or altered tissue perfusion, cardiac output. What happens there is the heart will try to increase or enhance the cardiac output by increasing the pumping action, heart rate, and stroke volume. This leads to your cardiac. More and more, the compensatory mechanism of the heart will start, and if not managed proper time, then heart failure or heart dysfunction can also be occur. Then nervous systems in physiological, and what happens in pathophysiology of the nervous system due to MOD, that is alternation of the mental function. The thing is that confusion, agitated, disorientation, lethargy, these things can be happens due to the hypoxemia conditions. Then as you know, due to hypoperfusion, the cause is there is hypoperfusion. So due to this hypoperfusion, acute renal failure, you have already know how hypoperfusion can lead to the renal failures. So renal system can also be impact, and ARF or AKD can be also happen due to this MOD. And metabolic disturbances will be there, like in the conditions due to overproduction of the catecholamines, glucocorticoids, there is hypoglycemia and insulin resistance. This leads to your muscle fat losses. Then coagulopathy. As you know, so why coagulopathy is there? Anybody can say? What happens to the coagulation factors? What happens? In inflammation. Can say anybody? Sangeeta is there?
Deranged prothrombin time.
Okay, so what happens in inflammation? There is clotting factors, fibrin, the clotting factors. As you know, the process of inflammation, the healing process, there is accumulation of fibrin materials, and the platelet can also come to that inflammatory sites. So due to that, there is decrease of these clotting factors or depletion of these platelets and fibrins that leads to coagulation disorder. Okay. So next comes to the sign and symptoms of MODS. As you know, the sign symptoms depends upon what organ will be affected. So in respiratory, what will there? In respiratory, as you know, dyspnea, perfusion mismatch, pulmonary hypertension, increased respiration rate, tachycardia, tachypnea, hypoxemia, alveolar edema, decreased effect and due to accumulation of these infected materials. Okay. So in cardiovascular, hypertension, myocardial depression, vasodilation, heart rate, then increased cardiac output, decreased stroke volume, and mean pressure. In neurological, as you know, neurological status, there is seizures, confusion, encephalopathy, hepatic encephalopathy. So, what is the meaning of hepatic encephalopathy?
It's because of accumulation of ammonia in a brain. It's a complication of liver cirrhosis,
Yes.
and liver failure.
Yeah, okay, you are right. So due to this liver cirrhosis or liver failure or due to liver dysfunction, there is disorder or dysfunction of the brain. This can lead to one of the vital organs, livers. So this can lead to
That leads
encephalopathy.
to coma.
Yes, coma. Very good. So these are the symptoms. Then GI systems. That is portal hypertension, GI bleeding, mucosal ulceration, infection, that is hypoperfusion, decreased peristalsis, paralytic. So if you go to pathophysiology sign symptoms, so many things we can going to find also. Then hematological decrease, platelet, anemia, leukopenia, increase in bleeding time, PT, increase in FPTT. So these are the things, hematological. So anemia is there due to massive blood loss, massive injury, leukopenia and leukocytosis. Why these two things are occurs?
Um,
You can say
leukocytosis.
there is a decrease and increase in WBC side. So these are two opposite things. So how this leads to your MOD?
Because the leukopenia, because it's a fighter cells in our body. If a leukopenia, that means a decreased white blood cells in our body, so the body can't fight proper. So the person will be more suspected to get
Yes.
infection.
Very good. In leukopenia is one of the cause of both leukocytosis and leukopenia are the directly related to your multi-organ dysfunction. In leukocytosis, as you know, due to any infection, the WBC count will be more.
Mhm.
Yes. And due to leukopenia, that is the conditions in leukemia. Example in leukemia, the amount of WBC will be less. So due to less, what happens? As you said already, you are right. That is, the person is very prone to infections, and these infections can lead to SARS and sepsis and lead to your multi-organ dysfunctions. Okay, endocrine. Increase the hormonal levels, ADH, ACTH. These are the stress hormones also, and hyperglycemia. Renal systems. There is disturbance in the kidney function. So the urea, creatinine, these are the things will be the waste products will accumulate in the blood. And as you know, there is oliguria, and due to this renal function alternation, there is alternation in the fluid balance, alternation in the electrolyte balance. It is very clear that the kidney has a vital role in maintaining the balance in the fluid electrolyte and also maintaining the homeostasis in your body. So, what is the diagnostic evaluation of multi-organ failure? So, anything, any disease, we can go for total history collection, physical examination. If a patient coming, you are doing duty and a patient is coming to your casualty, having multi-organ or in emergency ward, coming with multi-organ failure, then first of all, you have to collect the history. After that, you have to do the physical examination in history for the underlying causes. If the person is having hypertension or oliguria or anemia, tachypnea, immunocompromised patient, community or non-nosocomial infection is there, hypothermia is there or not. Then other things also you can to collect whether the so many things in history. That is the whether the client is taking any medications, if the client is taking any aspirin or any, but so many things you have to cover in the history. And in physical examination, you do all the head to foot examination and can find there is abscess, there is prostatitis, there is ascites, anything you can find in the physical examination and other investigations. So not only from the history and physical examination we can see what is the disease. In diagnostic evaluation, history physical examination is compulsory. After that, for confirmation of the disease, investigations, that is some blood test and other radiological examination is very much essential to learn what is the actual disease. So routine examination, that is CBC, urea creatinine, sodium potassium, other some test, blood culture, cardiac enzymes, CRP, urinalysis culture, then metabolic profile, amylase, lipase, some spinal fluids like CSF to rule out whether the client is having any meningitis, any other diseases, spinal cord disease or not, etc. Then also other investigations are there: CT scan, ultrasound to rule out if there is liver organ is damaged, then kidney ultrasound, then CT scan, MRI to rule out whether there is encephalopathy or not. Everything. Okay, so next comes to the management. So under management of multi-organ dysfunction test, so there is prevention and treatment of infection. First management is how we have to prevent and treat the infection. So most common cause of this MODs, that is sepsis or infection. So you have to prevent infection and treat what is the cause of the infection. So aggressive infection control strategy are essential to decrease the risk of nosocomial infection. So you can prevent in the hospital acquired immunity infection or nosocomial infection. Then if the patient is having already infected, then we have to send the fluids for culture, and according to the culture report, which is very sensitive, that according to that we have to administer the broad spectrum of antibiotic, early aggressive surgery. If there is to remove any necrotic tissue is there, we have to remove by surgery. And also aggressive pulmonary management according to system, according to which organ is damaged, we have to treat accordingly. Then common management for sepsis bundle, that is intraarterial line, endotracheal intubation, urinary catheter, IV line, and invasive lines like central lines. So these are the things done for management of the sepsis. Then to control the inflammatory mediator or to control the inflammations, you have specific treatment, that is positive nitrogen balance by proper nutrition, promotion of sleep, rest, and management of pain, that is analgesic, and also different control inflammatory mediators. You can apply tumor necrosis factor and like interleukin 1, etc. Then tissue perfusion, as you know, due to very inflammation, infection, we have also discussed in pathophysiology how there is altered tissue perfusion and hypoxia, hypoxemia to prevent that things. For example, myocardial dysfunction is there. You have to give sedation, proper rest, mechanical ventilation to improve the perfusion. Give analgesic, then proper rest, and for rest is required to decrease the oxygen demand. And if by these things is not maintained the oxygen demand, you can apply artificial oxygen to the clients. And so what is the different modes and methods of delivering oxygen to the clients?
Sorry, ma'am. Could you please clear the question?
Oxygen delivery methods.
Yeah,
Nasal
it's start from
cannula,
nasal probe.
Nasal
mask.
cannula, face mask, nasal swab,
Cannula is there.
ventilator.
Very good.
Eventually, mask
So
now will be that mask.
yes. So are you able to tell me what are in which cases cannula is there and which cases we have to give the mask? So many things are
For
there.
COPD patients, we have to give cannula. Through neck
Yeah, if
cannula, we have
someone
to
is
give
on
oxygen.
multi-organ failure, the patient mostly will be on ventilator.
Ventilators. Here, ventilator is essential. Intubation, tracheostomy is essential. So, ABC monitoring regularly. ABC monitoring is very much essential. And these are the things you have to done for the client. The nutrition and metabolic needs, right? The main aim for the nutritional support is to preserve the organ function and to prevent further damage, to provide healthy and optimal nutrition, and to improve the morbidity and mortality rate. The use of enteral role is also, if the client is not able to take orally, then we can administer by enterally. Or parenteral nutrition is essential. Then protecting organ affected. We have to prevent further injury by mechanical ventilation, by administering oxygen, and also these are the things we have to done. Then others for sepsis we have to do. That is hemodynamic. If the parameters, hemodynamic parameters are unstable, you have to stable the parameters by administering some inotropic drugs, by administering the fluids, etc. Like your adrenal, sorry, what are the drugs you can give, administer?
Adrenaline, NORAD,
Yes, NORAD,
um,
dobutamine.
dopamine.
Yes, dopamine you
Yeah.
can give for maintaining the vital function. Then, what is the prognosis of this MOD? If the process of MOD is not reversed by the day 21, it is usually evident that the client will die. যদি 21 days, within 21 days the patient will not reverse, then the chances of death. The death usually occurs between days 21 to 28 days after the injury or precipitating event. Not all the clients with MOD die, but MOD remains the leading cause of death in the intensive care unit with mortality rate 50 to 90%, despite the development of better antibiotic, better resuscitation, and more sophisticated means of support. For those clients who survive, the average duration of intensive care unit stay is only 21 days. The rehabilitation, which is directly directed at recovery of the muscle mass and neurovascular function, lasts about 10 months. These are the for management, prognosis. So next comes to nursing management. As So you can tell me what are the possible nursing diagnosis according to Nanda?
They have a impaired tissue perfusion
Very good.
Ineffective breathing.
and
Fluid volume deficit,
Ineffective breathing.
Very good.
yeah, impaired gas exchange and
Yes.
Altered nutrition.
Good. Okay. So you have to focus on
Activity
these things.
intolerance.
Reflectiveness,
Altered tissue perfusion.
impaired gas exchange. You are you have already all these things. Impaired nutrition and
risk for secondary infection.
very good.
fluid
Risk for
balance.
impaired skin integrity, knowledge deficiency, so many things. And in conclusion, MOD is a syndrome and it's due to the multi-organs progressive failing and due to prolonged inflammatory response. The early diagnosis and interventions are necessary for best possible outcomes. A critical component of the nursing role is vigilant assessment and ongoing monitoring to detect the early signs of deterioration of the organ functions. So this is all about MODS. So any doubts if people are having?
Ma'am, please share this PPT.
Okay, I will share definitely. No problem is there. So the next things we have to discuss or any doubts? So what things we have covered in SARS, sepsis and MOD. So in summarize, SARS is only
Ma'am, for exam, which part is important?
for exam. You have to cover all these things, whatever the things in your syllabus. But MOD is important. Okay.
Okay, ma'am.
Okay. So you can summarize, or let's we have to proceed the next topic. So
We can
why
go
very
to the
less
next topic.
people are there? Why very less people are joining here? Not other people. They are not able. They are not getting the time. So next thing we have to uh, discuss. So trials and coding. What is trials?
According to
It's,
color
it's the
code, we are
priority.
divide.
It's the priority for the care.
What?
According to color code, we are prioritize the patient during any crisis situation.
So that is color code means that is coding, and uh, the things is that is
Providing care according to priority of the patient, priority need of the patient.
It is the assessment of the patient of severity of the patient,
yes,
prioritizing the severity of emergency.
prioritizing the severity. You are right. So trials is the process of prioritizing the patient's treatment during mass casualty events. ATLS. What is ATLS? What is that? Full form of ATLS. We can say
Not sure, man.
advance.
Is it triage? No.
No.
Advanced
Advanced.
trauma life support.
Yes. Advanced trauma life support. Anybody have message? Please add me because what is how? There is a link you have to join. So how will you add? No, ma'am, I am not added in the scope. So I have to send the screen to that person. Okay, so what is trials? Trials is the process of prioritizing the patient treatment during mass casualty events in ATLS. So there is life support, two types, that is advanced trauma life support. The patients are classified according. So what is trials? Trials is the process of prioritizing the patient treatment. The prioritizing, the process of prioritizing, that is the trials. Okay, these things only. Prioritizing the patient during the treatment, and it occurs where? During the mass casualty event, like different conditions. We can say what are that conditions?
Emergency department usually we have the triad system.
Different calamities. Okay,
During disaster,
disasters, calamities.
Road traffic accident.
In India, it's especially flood.
So the patients are classified according to type of urgency of their conditions, like the patient can get treatment, and here one principle is that so there is right patient to the right place at the right time with the right care provider. The triage is a French word, and the meaning of this word is to sort, refers to the process of rapidly to sort out. Huh?
we are not seeing the slide.
Not able to see.
No, ma'am.
Okay. Got it? So triage is a French word that means to sort, to, to sort out the process of rapidly determining patient acuity, which patient needs prompt treatment. And in other words, you can say triage refers to the process of sorting sick and injured people on the basis of urgency and the type of condition, so they can be routed to appropriate facilities for medical treatment. So clear? The process of sorting, the process of rule out, the process of prioritize is the meaning of trials. Clear?
Yes, ma'am.
So, what is the aim of these trials? To ensure that the patients are treated in the order of their clinical urgency, to ensure that the treatment is appropriate and timely, to allocate the patient to the most appropriate assessment and treatment area, to prevent unnecessary congestion, to prevent acuity, sorry, to waste unnecessary, to prevent unnecessary wasting of time, to identify which patient needs prompt treatment and which needs the late treatment, also to provide ongoing assessment of the patient. So not only to identify the prioritize, but also coming to the ongoing assessment. Once assessment is done, if some patient prioritize, also those are in the less priority area, less priority clients, we have to reassess or doing assessment in ongoing process and provide information to the patients and family regarding services, expected care and waiting times, and also to contribute information that helps to define departmental acuity. So these are the aims of price. So there are different types of price and they are according to their objective and methodology. So there are three types of trials. One is primary trials, second one is secondary and tertiary. So primary trials is otherwise known as field trials, secondary trials is known as ED trials. ED means kana? Students, can you able to tell me what is the full form of ED?
Emergency department.
Very good. Emergency department and tertiary trials. So, in types, in primary trials, the objective or the methodology is yearly transportation, start and save life. So we will discuss what is start and what is save. The start and save is the methodology or objective in primary trials, that is under disaster scenario or in the field area of the disaster, and secondary trials the objective is the timely and appropriate intervention and color coding, and in tertiary trials that comes to you that is specialist care is coming under that. Clear?
Please repeat.
Okay,
Please repeat.
please repeat. So
Yes, ma'am.
three types of trials is there: primary, secondary and tertiary trials. In primary trials, yearly transportation. In secondary, timely and appropriate intervention. And tertiary trials belongs to specialist care. First of all, for example, in a disaster, your calamities, earthquake, you have to identify so many casualties there. So in the form of trials, what you will do? You have to first yearly transportation. You have to identify which clients needs the prioritized care. You have to first identify the clients and transport to that clients. That is your primary trials. And secondary, after identification, you have to give the intervention. That is your color coding. And in tertiary trials, specialty care. After intervention, some patient is not required some specialist care. That means intubation, ventilation, hemodynamic stabilizing. So these are under specialist care. Clear?
Yes, ma'am.
Okay. So next. So we can categorize the patient in three categories. Those who will in trials will categorize the patient in three types also. Those who will need die no matter, ତାକୁ ଆମେ କୋଉ category ରଖିବା? Those who will do well no matter what will do. Those who will derive long-term benefit from acute intervention. So as coming to disaster trials, जोटा हमें पढ़िଥିଲେ primary trials. Huh? So what is that? Start and save. So what is start and what is save? The full form of start. Anyone can say? Start from there. Okay, we'll discuss. So what is this is coming the disaster. These are under
तो यूज नहीं करते तो increase air days like
disaster phase. So what is that? Disaster diary. Do the greatest good to the greatest number of clients.
means आप admin हो तो obviously
There is it. So,
there will be but ऐसा है कि don't need मतलब हम बात कर सकते हैं कोई या कुछ आप क्वेश्चन वगैरह पूछ सकते हैं
so do the
हो सकता है तो हमें
greatest good for the greatest.
ऐसा है कि जिसको
Start. What is the full form of start? Why there is raising hands? If people raise your hands. Tuktuki? Any doubts if people is having?
Not at the moment.
Okay. So, what is this start and what is save? So start, the full form is simple triage and rapid treatment. Okay, so as you know, this is the primary triage and should be done in the field where where there is the things is happened here, the disaster is happening, in this spot this triage is done by rescuing the personnel. And the formula of quick assessment is you have to identify the things, that is respiration, perfusion, mental status, the things you have to identify. So what is the start triage process? You have to first identify whether the client is breathing or not. So if yes, there is a two options, yes or no. If there is no, open the patient's airway and find out whether the client is breathing or not. If there is no, then the person is dead, and if yes, then immediate care. And if patient's breathing is present, then you have to identify whether the breath is less than 30 say breath or more than 30. If the person is taking the rate of, or if the respiration rate is more than 30 beats per minute, you have to give immediate care. And if less than 30, then you have to palpate the radial pulse. And if you are getting to palpate the radial pulse, if there is no pulse, then you have to control the bleeding, immediate care. And if respiration is okay and pulse is present, you have to assess the mental status of the client. If mental status is good, then you can also delay the care. If there is altered mental status, you have to give the immediate care. Able to understood?
Yes, ma'am.
Yes, ma'am.
Okay. Then safe. So what is the full form of STAT? Semi.
Simple tries and rapid
Secondary
treatment.
assessment of victim
Secondary assessment
victim
Simple trial and
of
rapid
the
treatment. So next principle is in primary trials, safe. So what is safe trials? Safe the full form?
It is the secondary
Secondary
assessment of victim and
endpoint. Okay. So in secondary assessment, so what is primary assessment and why there is necessary of secondary assessment? Can you tell me?
In-depth examination.
Not only depth, but also depth examination, not only, but you are partially right, but it is also required if there is delay in the transport. Okay, so when the patient are likely to have significant delay in transport, or more time is required from the scene, that is number of casualties exceeds the transportation capacity or damage to the hospital infrastructure. You have to prioritize, you have already prioritized the clients for shifting, for transport, but there is not adequate transport facilities, and you know the client require immediate intervention. Then you have to reassess, or again and again you have to assess the clients. Then helpful to identify patients who are most likely to benefit from the care available under these field conditions. So two conditions: if there is delay in the transport, another things, whether if the clients, you have to identify the, if the client is stable also. In some patients they need a more assessment to, that is in, you have some patients they have to monitor, that's why reassessment is essential. So what are the area of safe assessment? The area, the vital signs, airway, the chest, abdomen, pelvis, spine, extremity, skin, neurological status, mental status. You have to identify in the safe trials. Then in the category, safe trials, there are three categories: the 1, 2, and 3. Under first category, the patient will die regardless of how much care they receive. There are many patients, even if we have to give the sophisticated care, the specialist care, and the advanced technology care, we cannot save the life of the patients. The patient will die definitely. That's in that case, we have to only provide the comfort care. And in second category, the patient will survive whether or not they receive care. The, you may give care or may not give care. the patient will not able to death. For example, in fracture patient only or minor injury, patient will be survive, but we have to prioritize first those patients who need immediate care. After that, this patient will be transport. So these are under delayed care category. And in category 3, the patient who will benefit significantly from field intervention immediately care. There are some category of patients, those vitals are not stable, so they are belongs to immediate care. So periodic assessment of category is very important. So there are guidelines for some safe trials. First one is cross injury. So there are many guidelines in safe trials in cross injury, that is lower extremities. So there is a different score there is GCS, there is MES score for limb extremity damage. So if that score you can follow, or if you would not understand, then I can also explain the class. Then there is MES score. If there is more than 7 or more than 7, we can amputate the clients, and if the score is less than 7, the attempt to save the limb and immediate transport is required. There is head injury. As you know, these things is being monitored by your GCS. If the score GCS is 8 or above, then you can the pace. As you know, according to GCS, there is scoring the normal GCS score. What is that? 15. So according to GCS, there is many categories: mild, moderate, severe, and if the score is 8 or over, that is better than 50% chance, and normal is good neurological recovery. And if the less 7 or less, that is in the moderate, only comfort care. And if score less than 3, you have to give the prompt care. Then born injury. In born injury, less than 50% chance of survival, 70% TBSA born, is more than 60%, is less than 2% with 50% TBSA, is more than 60 with 35%. This patient only need the comfort care.
Ma'am, not visible screen, ma'am. Please screen.
Not visible.
It's
Yes, ma'am.
visible at the moment.
Yes,
So
ma'am.
you can rejoin. You can rejoin again. So abdominal injury, no data to guide the evaluation. So and to hypotension, if no response, comfort care only there. Then trials in the emergency department. So that things we have to discuss in the field. That is start and save. These trials is provided in the field area, and that is the primary trials. And in the secondary trials, that is the ED. Able to get me?
Yes, ma'am.
So in primary trials, two things coming, that is your start and save. And in the ED, what the things we have to follow? Emergency department trials. Trials establishes priorities for care and determines the clinical area of treatment. And in clinical, that is in hospital side. Even if trials has been done at the scene or in the field, trials is also needed for emergency entrance, department entrance. Because there are many patients may be transferred from the field to ED, emergency department. So here also we have to give prioritized care. So to accomplish the most good for the most number of patients, the trials team should evaluate all the patients arriving at the ED and classify their conditions with regard to severity of injury and need for treatment. So key points, the assessment in the ED, you have to assess the area must be immediately accessible and clearly signposted. Its design should be allowed for patient examination. The area, the trias emergency in ED, the area, you can see the trias area, there is a picture. So is the design is in such a way that you can easily do patient examination, easily communicate to the clients, and also privacy, which is very much essential during physical examination for the clients, maybe male, maybe females. Then strategy to protect the staff will exist. The same standard for trials categorization should be applied also in the emergency department. the trauma should be, the victims of trauma should be allotted a category, and because there is a category, there is coding, and the patient should be identified by that band, coding band or coloring band. It will be easy for the doctors or nurses to provide care. The patient presenting with mental health or behavioral problems should be tried according to their clinical and situational urgency, as with other emergency patients. Where the physical and behavioral problems coexist, the highest appropriate rise category should be applied based on the combined presentation. So here only the things we have to give, that is in the emergency department also we have to identify, the prioritize the clients, give color coding, and accordingly we have to provide care. Then what are the equipments required for the for trials in the what are the things required in the emergency department? As you know, emergency equipment, there's a crash trolley, there is facilities of universal precaution, that is hand washing, gloving, capping, masking, adequate communication device. In communication, what is that? Intercom telecommunication or the landlines communications. That is for recording the informations. And triage team. In an emergency department, there are so many people are involving in the triage team, like physicians, emergency department nurse, medical records, admitting clerks, etc. And also, the physician performing hospital trials should acknowledge by being in command of the trials area, should be clearly identify the specialty color. The physician should identify the coding and which patient needs first care and which one is uh, need the delayed care. One member of the trials team, admitting or medical records clerks, should be assigned the job recording the victim's name on the disaster tag along with the identification. One body should be responsible for identifying the clients. And if identification of the patient is not available, ethnicity, gender, approximately age should be recorded. An initial diagnostic impression should be done, and this information is entered in the logbook of the clients. Then category or coding. This is all about the trias. So next one is third one, that is your tertiary trias, and that needs your specialty care, ventilator or hemodynamic stabilization, dynamic monitor, that is on the third category. So next coding, and here we have to discuss trias and coding. So what is that coding? Four colors are required to code the trials, that is which color? Red, yellow, green or black. So able to getting me? Am I audible, students?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So there are so many colors, like four colors: red color, yellow color, green color, and black, depending on the injury severity and prognosis. The trials category is identified by use of color band or trauma disaster tag. There is band or color tag for the clients. So here there is a color and which one is priority, which one is most urgent. Red, yellow, green or black. ଯେକୌଣସି ତିନିଟା କଲର ୟୁଜ୍ କରିପାରିବ, ଚାରିଟା କଲର ସରି. So red color, first priority, most urgent. So what is the condition? Life threatening, shock, hypoxia is present or not, but the patient can be stabilized. So here the life threatening clients like sepsis clients, shock clients, hypoxia, not stabilized, unstabilized clients, vitals is not stable. So these are under red category, most urgent and first priority clients. So next coding is yellow color. This is the second priority, and this one is not most urgent, it is urgent. And the which patient is coming under shock patient, life threatening or hypoxia, and given appropriate care can be withstand. So those patients can live without can withstand if we delay 45 to 60 minutes. Able to getting me? Are you able to understand what I have said?
Yes, ma'am.
Yes, ma'am.
Yes. And third one is green, third priority and non-urgent. That is accident clients, injury with minimal care, which requires minimal care. Okay. So now last one is black. Jadi if the black tag or black color band the person is wearing, in that case you have to understood the person is dead. Okay. So no care is needed. No distinction can be made between clinical and biological death in a mass casualty. Only unresponsive patients who has no spontaneous ventilation and circulation is classified as dead. So these are the codings. So these you can see here, tracing or bandage or tags like this, green, yellow, red. So which one, which among these color, which one needs priority care first?
Red,
Red. After
Red.
that,
yellow,
Yellow.
Yellow.
then green,
Green.
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 The the person wearing black bandage means
No need for
Dead.
dead.
okay. So what are the documentation is also required when the tries patients, that is the date and time of assessment, name of the doctor, who is the nurse attending to the clients, if the problems, limited relevant history, relevant findings, whatever finds, initial tries category and diagnostic, what are
Go
the
to
investigation,
very Canada Sasan.
what? Are you telling anything? Okay. The tertiary trials is that things done after initial resuscitation and stabilization following emergency department. So in primary trials, what happens? There is start and safe. In secondary trials, intervention. We have to give care, and tertiary to stabilize. After resuscitation, stabilization, tertiary trial is essential. That is by specialist, not by specialist care like your cardiologist, neurologist. So these are the special cares. And some patients needs emergency surgery, some patients are admitted to ICU, and some patients can be discharged from their sides. So this is all about price and coding. Any doubt? So next we will discuss regarding polytrauma. So what is that? Are we able to see?
Yes, ma'am.
Okay, so polytrauma, what is the meaning?
Multiple injuries.
In this person, where the
Multiple
many
trauma.
organs get affected.
Multiple trauma.
Very good, very good. So what is trauma and what is polytrauma? 1 minute.
Trauma means any parts of injury in the human body. Trauma means injury to the human tissues.
So here, the term trauma describes a variety of injuries which possesses a major challenges for pre-hospital care, emergency care, critical care, and surgical care and rehabilitation of a patient with trauma. So simple. The trauma means injury to the human tissue, isn't it? Yes.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
The trauma is defined as any intentional or unintentional wounds, maybe intentional, maybe non-intentional wounds or injury inflicted on the human body from a particular mechanical mechanisms that exceeds the body's ability to protect itself from the injury. Any trauma means it is beyond the body's ability to protect itself. So, which is out of body's ability, that is your trauma. Any force, any intentional or unintentional injury that the human body from a particular mechanical mechanism exceeds beyond the mechanical mechanism. So, what is polytrauma? Polytrauma is a multiple. Poly means many. Multiple polytrauma is a significant injury in at least 2 or more out of these 6 body regions. So out of these 6 regions, if there is at least 2 body regions, it is under polytrauma. So out of 6
Head, face, limbs, external skin,
cervical
or
spine, face, chest, thoracic spine, abdomen, lumbar, limbs, bony pelvis, external pelvis, etc. So, what is the definition of this polytrauma? It is expanded to include concurrent injury to 2 or more body parts or systemic that results in cognitive, physical, psychological, or psychosocial impairment also. Not only in the physical only, but also so in psychological, cognitive impairment is under in the polytrauma. If 2 or more systems, not only the body parts, also if 2 or more systems that results in the cognitive, physical, psychological, or other psychosocial impairment. Injury description, AIS score. So according to AIS score, the injury may be classified minor, moderate, severe, serious, critical, and very critical. Okay, you have to go through that. If there in head and neck, cerebral confusion, the AIS score is 3. If face, no injury, 0. Chest, there is fall, chest, that is 4. Abdomen, minor contusion of liver, that is 2. And complex rupture is 5. Extremity fracture ଯଦି ଅଛି ତାହେଲେ 3. ଯଦି no injury, that is 0. The criteria for polytrauma include any one of the following combinations ଆଉ ଗୋଟେ କ୍ରାଇଟେରିଆ ପଲିଟ୍ରମା କହିବାକୁ ହେଲେ so two major system injury plus one major limb injury, one major injury plus two major limb injury, one major system injury plus one open grade 3 skeletal injury, and another is unstable pelvis with associated visceral injury. So out of so these are the criteria. If there is two major system plus one major injury, it is under polytrauma. If only one major system injury, two major limb injury, it is also under polytrauma. If one major system injury plus one open grade 3 injury, that is also in polytrauma. If unstable pelvis with associated visceral injury also there, that is also under polytrauma. Then what is the golden hour for early trauma? It originated by R. Adams Cowley. First 6 minutes after the occurrence of the multi-system trauma, and victims' chances of survival are greatest if they receive definite care in or within first hour after a severe injury. This is actually golden hour. 1 hour within or in or within the first hour after injury is your golden hour. Clear? Is it clear? Yes or no?
Yes, ma'am.
So little speed is there or right? It will okay or I will slow little bit. Are you able to understand what I am teaching you?
Yes, ma'am.
Yes,
So
ma'am.
any comments if we'll little bit slow or whatever is going that is okay.
It's okay, ma'am. It's okay.
Okay, because we have to cover so many things within less hours. Okay. So etiology of polytrauma: RTA, fall from height, airplane crash, train derailment, assault, blast, thermal and chemical injury. Okay. Types of trauma. Trauma can be following: blunt trauma, rapid deceleration, burn or penetrating trauma, polytrauma. So blunt trauma means cross, sports injury. There is no sharp instrument. Well, that is called as blunt trauma. And rapid deceleration, that is your during motor vehicle accident, that is called as rapid deceleration. And a burn due to electrical, thermal, that is chemical or radiation burn trauma is there. And penetrating, there is bullet injury or sharp wound, that is called as, or any knife injury, that is under penetrating trauma. So pathophysiology of trauma. So there are complex phenomenon in the pathophysiology of the polytrauma. It can start simple injury to also death condition. The person may also go to death if severe blood loss is there and alternation in the hemostasis. Patient can go to shock, can go to death. So there is so many pathophysiological changes are there. So anybody can say. Can you correlate? What is the pathophysiology? So due to trauma, what will happen? What will happen? Anybody can identify?
Yes, ma'am. MODs, pathophysiologies are related
Yes,
to polytrauma pathophysiology.
yes, MOD, SARS, MOF.
SARS.
Huh? So you can go read the pathophysiology. There are so many things. Like what happens? Anybody can explain me a little bit more? Some clue you have to give. What
Ma'am,
happens?
repeat this question.
Any one pathophysiology can you tell me?
At first, tissue is break down during the any trauma situation. After that, the
Hmm? Yes. So in pathophysiology of trauma, for example, there is if SARS, that is MOD, oxygen delivery demand, there is a pathophysiology, hypotissue perfusion. Yes or no?
yes, ma'am.
SARS, you can correlate the SARS and sepsis MOD to the
MOD.
pathophysiology of polytrauma. There is coagulopathy. Yes, you can relate. There is hypothermia, central nervous systems, all the physiology there in the book. So nicely, we have also discussed in MOD and you can follow it. If any doubts will be there, we can also discuss in the next class. Okay?
मैम स्टडी मटेरियल के बारे में कुछ हुआ है मैम बातचीत
क्या?
स्टडी मटेरियल
Study material you will get through post. Ma'am told na.
मैम अभी तक स्टडी मटेरियल नहीं आया है हम लोग के पास.
So you can communicate it to ma'am. You can discuss with principal ma'am.
Ma'am, so we are facing problem.
Okay, okay. So you can download the soft copy till until you will get the materials. You can also contact ma'am. They can for
मैम
reference.
मतलब जब हमने फॉर्म फिलअप किया था उस टाइम मतलब ये एक ऑप्शन था जो हार्ड कॉपी लेना है उसके लिए अलग से रुपए लगेगा और सॉफ्ट कॉपी के लिए अलग तो हम लोग क्या किए थे हम लोग मतलब हार्ड कॉपी के लिए हम लोग फॉर्म फिलअप किए थे लेकिन बोले थे कि 3 महीने के बाद ही पहुंच जाएगी लेकिन अभी तक तो नहीं मिला फिर अभी असेसमेंट और बहुत ज़्यादा कुछ सब कुछ करना है अभी ये दिक्कत थोड़ा हो रहा है अगर आप डाउट थोड़ा क्लियर कर देते तो बहुत अच्छा था मैम
Okay, I'll discuss also
पढ़ने के
today.
लिए हार्ड कॉपी मोस्ट इम्पोर्टेंट देन सॉफ्ट कॉपी.
Hard copy is compulsory. Hard copy is very much essential for that.
और
Okay,
मतलब
I will discuss.
मैम अगर हम लोग सॉफ्ट कॉपी प्रिंट करने के लिए जा रहे हैं तो एक 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 छोटा मतलब पहले एक कॉपी के लिए 10 रुपए तो
I
मतलब
know, I know. I know it's very difficult and it is impossible to
और
read it.
फ़ोन पे देख के असाइनमेंट करने में बहुत दिक्कत हो रही है मैम तो प्लीज़ अगर हम लोगों के लिए आप ये थोड़ा कोशिश करते तो अच्छा था मतलब
Today,
3 महीने के बाद ही पहुंच जाना था
ठीक है, no problem. I will discuss today with ma'am.
ऑलरेडी 5 months ओवर नाउ.
Okay, okay. So I will discuss today what she is tell. I will communicate with you. Okay, so let me finish these things. After that, we will discuss. So, what is the
Okay, ma'am.
sign symptoms? Sign symptoms of polytrauma and also complications. So, sign symptoms will get commonly and in systemic also. Which system is involved? So cardiac systems, if there is injury to the hearts or if trauma to the hearts, maybe what will happen? Tachycardia, systolic hypotension, narrowing of the pulse pressure, cardiac failure. Heart failure will be there, and skin, cool and clammy skin, pale cyanotic skin. In central nervous system, anxiety, restlessness, confusion, alternation in the sensorium, decreased level of consciousness. There is renal system, decreased kidney output, and glomerular filtration. All things I think you have already discussed in also in MOD. You can correlate that. And in pulmonary tachypnea, ARDS, hepatic system decreased clotting factors, impaired drug metabolism, reduced serum glucose, decreased phagocytosis. In GI systems, the dynamic adynamic ileus, ulceration, decreased absorption of nutrients, increased toxic products, and in vascular, DIC, disseminated intravascular coagulation, anaerobic metabolism. These are the different signs and symptoms of this trauma. Then complications. The complications is categorized three things. So immediate, early, and latest. What is the immediate complication? 50% client will die within minutes due to brainstem and high spinal cord damage. And others are laceration, cardiac rupture, then airway obstruction is there. Then early complication, 30% of patients die within hours of injury due to severe head injury. Massive blood loss within the chest or abdomen cavity, severe hypothermia, metabolic acidosis and coagulopathy. Due to that, 30% patient will be died. Then lead complication, 20% of the patient will die within few weeks after trauma. Lead complication. So complication within minutes, within 1 or 2 minutes. Early complications within hours and late complications 1 week, within 1 week. Bleeding from inadequate homeostasis or undiagnosed injury, infection, and ARDS and MOD. Due to that, ARDS, MOD, late complication will occur, and due to that, within a week, the patient will be die. So, what is the diagnostic evaluation of bodily trauma? History, physical examination, ultrasound, X-ray, CT scan, MRI, and certain blood test will be done. Then, what is the assessment? In assessment, that is your preparation, trials, survey, resuscitation, primary survey, secondary survey, and definite care. So, are you feeling bored? Yes or no? Have you understood?
Yes, ma'am.
Yes, ma'am.
So, shall we proceed or will remain here? Or we will discuss? So, in polytrauma assessment, we will keep it to the next class? Or we will finish?
Yes. No, next class, ma'am.
Huh?
Next class, ma'am.
Next class. So, today we
Yes,
have,
ma'am.
okay. So, up to
मैम और
diagnostic.
एक बात मैम और एक बात आज जो क्लास किए हैं हमने ये अगर ग्रुप में अगर दे देते तो अच्छा था तो और थोड़ा अच्छे से हम लोग देख लेते
Okay. ठीक है. Next, up to diagnosis we have discussed today, isn't it? Polytrauma, definition, etiology, pathophysiology, clinical manifestations. Then other one is diagnostical assessment. How will assess the client? So I'll share these things to you people.
Yes, यस मैम, ग्रुप में शेयर कर दीजिए मैम, हम लोगों के
Okay.
जो ग्रुप।
So you will read and we'll discuss these things in the next class. Okay.
यस यस मैम।
Yes or no?
Okay, ma'am. Okay, ma'am. Okay, ma'am.
Okay. So that things we will discuss in the. So now, are you able to get what is polytrauma? What is the etiology? What is the types of polytrauma? Then what is the pathophysiology? The signs symptoms of trauma. Okay. Then
यस मैम।
next one is assessment. The assessment, I think that is ABC management, ABC assessment. So these things like your other CPR assessment, like I think you people are already known, and I will share the PPT in the group. We'll go read, and if there is any doubt in the next class, we'll discuss. Okay.
Okay, ma'am.
So what topic we have discussed today?
ओके मैम। मतलब आज जो मतलब हम आपने
Ma'am,
पढ़ा है तो प्लीज़ पीडीएफ करके हम लोगों के ग्रुप में दे दीजिएगा मैम प्लीज़।
at
और
first we
मैम
are
और स्टडी मटेरियल के बारे में प्लीज़ मैम नेक्स्ट क्लास में कुछ हम लोगों को।
Okay. I today whatever the problems you have told in the last class, I have already discussed with ma'ams, and immediately also we have formed a group
मतलब
and if
हाँ
people are
मैम मैम
added.
मैम मैं जो बोल रही कि मैम आप ये थोड़ा क्लियर कर दीजिएगा कि हम लोग जो हार्ड कॉपी के लिए पे किए थे वो पे कम्प्लीटली कर चुके हों, और 3 मंथ के बीच ही हम लोगों को स्टडी मटेरियल मिलना चाहिए था, लेकिन अभी तो एग्ज़ाम मतलब पूरा नज़दीक आ गई है और असाइनमेंट भी क्लियर करना है, तो ये सब हम लोगों को अभी दिक्कत लग रही है। तो प्लीज़ मैम ये अगर आप थोड़ा सा मतलब फिक्स मतलब बोल दीजिए तो अच्छा है।
Definitely I will tell. Okay.
ओके मैम, थैंक यू
And
थैंक
tell. And you can also, you people are in the group also. So anything you want to discuss or anything you want to know, please share in the group. Mom is there directly, she will know from you people. So it will be better, I think. So what you want, you don't afraid. Anything you want, anything you require the query, you can share in the
यू
group.
मैम। हम लोग मतलब कुछ फ्रेंड ने ये मतलब मैसेज भी किए थे ग्रुप में, लेकिन कुछ भी आंसर नहीं मिल रहा है। मतलब हम लोग थोड़ा टेंशन में है। कुछ लोग मैसेज किए हैं कि मैम स्टडी मटेरियल कब मिलेगा क्या, ऐसा ये
Ma'am is
मतलब
written there. Ma'am has already wrote in there that in postal you will get study material. But the problems you are facing now, you can write it. Repeatedly, you can write it. No, nobody will scold you because what is your problem? So directly, ma'am will know your problems and she will able to answer you. Okay.
हाँ मतलब हम लोग तो बोल रहे हैं मैम, लेकिन आप अगर थोड़ा क्लियर करते तो अच्छा मैम।
I will discuss. I will discuss with ma'am today. Actually, today is ma'am's class, and she is on the travel. She is now traveling, so that's why I am taking the class instead of her. This is her class, assigned class.
यस मैम।
So, are you able to understand, or you are facing some difficulty in the class?
यस मैम। मतलब देखिए ये तो थोड़ा डिफिकल्ट हम लोगों के लिए हो रहा है, क्योंकि अगर हम लोगों के केवल स्टडी
If people
मटेरियल
are
रहते तो और
already
अच्छे से हम
in
लोग
a
क्लास अटेंड कर सकते थे और थोड़ा अच्छे से हम लोग बोल सकते थे, लेकिन
uh,
अभी क्या हो रहा है स्टडी मटेरियल नहीं है, इसलिए हम लोग भी थोड़ा कन्फ्यूज है, इसलिए मतलब अच्छे से बोल भी नहीं पा रहे और टेंशन भी हो रहा है।
okay. So why they are so late? I also don't understand. Okay, I will communicate and also tell you in the next
हाँ,
step.
मैं तो मतलब फरवरी से ही जनवरी में मैं एक बार फ़ोन किए थे, फरवरी में भी किए थे, लेकिन वो लोग मतलब वहाँ से बोल रहे कि हाँ हाँ मिल पहुँच जाएंगे, लेकिन नहीं पहुँचे। फिर मार्च में भी कांटेक्ट किए थे, फिर भी बोले कि मैसेज किए थे कि हाँ पहुँच जाएंगे, एज सुन एज पॉसिबल स्टडी मटेरियल भेज दिए हैं, पहुँच जाएंगे, लेकिन अभी तक नहीं पहुँचा है। तो ये पता नहीं क्या प्रॉब्लम है, तो अगर देखते तो अच्छा
हाँ
था।
ठीक है, I will
बार
discuss
बार
with.
आपको बोलने में भी मेरे को मतलब खराब लग रही है कि मैम मैं हम लोग बार बार एक ही बात दोहरा रहे हैं, ये भी गलत बात है।
Your rights. This is your rights, and you are facing problems actually. So no need to think otherwise. We have to very much accurate and practical. And actually, you people are facing many problems. I understood, but thing is that hope that you will get very soon, and I will discuss today from MEMS. So whenever your practical is there, whenever you are coming to practical.
हाँ, प्रैक्टिकल के लिए मैम ने बोला था कि प्रैक्टिकल के लिए हम लोगों को वो बहरमपुर में जाना पड़ेगा, लेकिन थ्योरी के लिए हम लोगों को जो पास में जो मतलब सेंटर है वहाँ पे हम लोग थ्योरी एग्ज़ाम देंगे, लेकिन पहले प्रैक्टिकल होगी उसके बाद ही मतलब थ्योरी होगा। और असाइनमेंट जुलाई 30 को देना पड़ेगा और अगस्त सितंबर के अंदर के पूरा क्लियर करना है। 1 2 3 4 मतलब ये 4 पेपर जो है वो पूरा असाइनमेंट क्लियर करना पड़ेगा, ये बोले हैं मैम ने। लेकिन एक पूरा हम लोगों को जो कन्फ्यूज़ हो रहे हैं, एक ही बात फिर से दोहराना पड़ रहा है कि स्टडी मटेरियल, क्योंकि ये डिस्टेंस कोर्स है, डिस्टेंस कोर्स में स्टडी मटेरियल अगर नहीं आए तो मतलब सब कुछ में बहुत कॉन्फ्यूज रहना पड़ता है। अगर बुक होता तो और भी हम लोग क्या
It,
बुक
it
में
will
एक
be
ही बार
very
बार बार
easy for
दोहराने
you.
से सीखेंगे।
Very easy for you if there is book. I think I understand your problem. And I will also discuss with ma'am today, and I will give importance to you and put your problems actually what you are facing with the people. So
ओके
don't
मैम।
be worry for that.
यस मैम।
You concentrate on study, whatever the things discussing in the class, please understood that. If any problem you are facing during the class, you can ask me in the next class. So somebody will take the screenshot and share in the group also in the class, or you can share me personally. The
मैम
attendance.
ग्रुप में आपने आज जो क्लास किए हैं वो ग्रुप में मतलब पीडीएफ करके दे दीजिए, हम लोग वहाँ से डाउनलोड करके हम लोग देख लेंगे मैम। जो
What?
एक ग्रुप, हाँ एक ग्रुप है मैम, एक एक ग्रुप ये मतलब डीसीसीएन का ग्रुप इग्नू से एक हम लोग एक खोला है, वहाँ पे आप लोग भी है, मतलब वहाँ पे दे देते तो अच्छा था।
हाँ ठीक है. You can give the attendance in that group. Okay. Have you
ये
taken the screenshots?
यस मैम।
मैम मैंने थोड़ा थोड़ा लिया, मतलब जो पॉइंट मेरे को लग रहा है कि मेरे को रिव्यू करना है मैं वही वही ली हूँ, मैं
Okay, okay.
शेयर कर दूंगी।
You can share that things that
ओके
way.
ओके मैम, आई विल शेयर।
Okay. So, any doubts if people are having?
नो मैम, नो डाउट्स।
मैम मैम एक्सक्यूज मी मैम। मैम हम लोग का वो जो असाइनमेंट का जो आंसर होगा हम लोग ऑनलाइन देख के लिख सकते हैं क्या?
Yeah.
मैं बोल रहा हूँ हम लोग का जो असाइनमेंट है, असाइनमेंट का जो आंसर है बुक देख के लिखना पड़ेगा या ऑनलाइन भी सर्च करके लिख सकते हैं हम लोग?
Whatever you need. If you think it is sufficient in the books, you can write. But thing is that you can add some more extra points if you want to know, or if you search other books, it's really better.
ओके मैम, थैंक यू मैम।
Assignment is how nicely you have written. The effort you give more, the marks will also give. You take more. Nicely you have to present all these things. So you tell your students that you people tell your students in the group, if there is any personal group, that your personal group, you tell everybody should join and take the attendance. Those who are leave the already leave, there are now 32 persons, and already some people those are joined and they have left, you can inform them and take the screenshot and send in the group. Okay. So anything you want to know, more things regarding today's class or any other things? So shall we leave the class?
Yes, ma'am. Thank you, ma'am.
Okay, thank you so
Thank you,
much.
ma'am.
You are giving your effort, your valuable times.
Thank
You are
you, ma'am.
concentrating on your study. I hope you will finish and complete your course very nicely. Okay. So am I leave the class?
Okay, ma'am.